Hello students, in the introductory class of the muscles of the forearm, I already told you arrangement of the posterior compartment of your forearm. Now in today's lecture, we will talk about the lateral group. Now you know that the muscles of the back divided into the two parts, superficial group and deep group. The superficial group is further divided into the two parts. Three muscles lies in the lateral or radial side. So these three muscles are Brachioradialis, Extensor carpi radialis longus and Extensor carpi radialis brevis. So let's discuss all these three muscles one by one. So what is the brachioradialis arrangement? Brachioradialis lies on the anterolateral aspect of the forearm. Now whenever you are seeing your forearm and you will see this bulging. Now this bulging is basically, or you can say predominantly, caused by the brachioradialis. Now this muscle is also contribute the lateral boundary of cubital fossa. Now you have a depression on the front of your elbow joint and this depression is known as cubital fossa. Now suppose if I will draw the cubital fossa, this is your medial epicondyle from where you have a muscle is known as pronator teres. Now in this way, when you will join this, you are having a triangular area and this triangular area is known as cubital fossa. So one sided it is bounded by the brachioradialis and one sided it is bounded by the pronator teres. So brachioradialis is an important landmark when you are doing the dissection in the cubital fossa. Now what is the origin of this muscle? Now see, you have to keep one concept in your mind which I already told you, that the muscles of the superficial group of the posterior compartment of forearm are not arising from the radius and ulna. If any muscle is arising from the radius and ulna, then this muscle has to be the deep group muscle. Because we are reading the superficial group muscles comes from the humerus bone. So this brachioradialis comes from the lateral supracondylar ridge of the humerus. So it is coming from the upper 2/3 part of the lateral supracondylar ridge of the humerus. Now here you can see that this is the lateral supracondylar ridge. Now this lateral supracondylar ridge is divided into the two parts, upper 2/3 and lower 2/3, lower 1/3. Now this lower 1/3 part is not from the brachioradialis. Brachioradialis attached on this upper 2/3 part of lateral supracondylar ridge and adjacent lateral intermuscular septum which is present here. Now the fibers of this muscle form a belly and this belly produced a bulging on the anterolateral aspect. Now the upper part of the muscle overlaps the radial nerve. Now in this diagram you can see that you have the exit of radial nerve and the radial nerve will come out on the lateral side. You know that there is a radial groove present in the posterior compartment of the arm and this radial nerve will pass from this radial groove to come out on the lateral side. Now once the radial nerve come out on the lateral side, it is passed below, or you can see that this upper part of the radial nerve is covered by the brachioradialis. So if you want to see the brachioradialis on this area, you have to split the two muscle. One is this brachioradialis and second you are having the origin of brachialis from this surface. So the groove between the brachialis and brachioradialis is lodging this part of the radial nerve. So this is the important thing to understand, that whenever you want to expose the radial nerve on the front, you have to split the two muscles. One is the brachioradialis on the lateral side and brachialis. Clear? Now what is the insertion of brachioradialis? Now this brachioradialis, after taking origin, first it crosses the elbow joint and then it will run downward. Once it will runs downward, you will realize that it is having a long flat tendon. So in the mid forearm, it converts into a flat tendon and this flat tendon ultimately insert on the lateral surface of the radius at the base of styloid process. So this is very commonly asked question in your exam, that where is the insertion of brachioradialis? Now here you can see that this is the styloid process. Now this is the lateral side of the styloid process. On this lateral side, you are having the insertion of this tendon of your brachioradialis. So, brachioradialis is a muscle on the lateral aspect and it inserts near the base of the styloid process and it arises from the lateral supracondylar ridge of humerus. So, here you can see the complete muscle and you have to keep this thing in mind that this lateral supracondylar ridge is having the two part, upper 2/3 and lower 1/3, and this lower 1/3 part is still giving origin to the second muscle which is known as extensor carpi radialis longus, and this brachioradialis is going downward and it will insert on this point of your radius bone, which is the lateral part of styloid process. Now, what is the important concept, that this lower part of the tendon of brachioradialis covered by the two muscle. Now, see, there is one very important anatomical landmark is here. Now, this is known as anatomical snuff box. Now, when you will do this prominency of your thumb, now you will find a depression on the base. Now, this depression is known as anatomical snuff box. Now, this anatomical snuff box bounded one side by the two muscle, abductor pollicis longus and extensor pollicis brevis. Now, these two muscle tendons are coming from the posterior compartment. These are the deep muscles of the forearm and they are going towards the pollex, that means our thumb, and once they are going towards the thumb, they are crossing the insertion of brachioradialis, which you can appreciate here that this is the tendon of brachioradialis and it is inserting here on this your styloid process. But there are two muscle tendons, one is this abductor pollicis longus and extensor pollicis brevis. Now, these two tendons are crossing this part of your lower part of the styloid process. So, this is the question of your exam, which muscle tendon crosses or lies superficial to the tendon of brachioradialis near its insertion. So, my dear students, you have to keep this thing in mind that this is the area of anatomical snuff box, and anatomical snuff box is bounded on the one side by the two tendon. What these tendon are? Abductor pollicis longus, extensor pollicis brevis, and on the medial side or it is bounded by a single tendon of extensor pollicis longus. So, how to remember this? Longus, brevis, longus, alternately longus, brevis, longus, and you have to keep both the extensor with adjacent line and abductor as a first word. First word is A. When you will have ABCD, your alphabet always start with A. So, how I will remember it? A, then longus, brevis, longus, and I am having two extensors. So, extensor, extensor, and all these three are going to the pollex. Now, these two will form the lateral boundary and they are going to cross the tendon of brachioradialis, and this is going to form your posterior or medial boundary. Clear? So, how to remember? You have to first start with the word A. So, A, then longus, brevis, longus. Clear? So, these two tendons are the tendons which crossed the tendon of brachioradialis at the point of insertion. Now, what is the nerve supply? Now, brachioradialis supplied by the radial nerve, and this nerve arises above the elbow joint. Clear? So, this is the important thing is that now already supplied this here. So, if the injury will occur after this area, still the brachioradialis action will remain preserved. Now, what are the actions of brachioradialis? Now, brachioradialis is a muscle of the extensor compartment. You are seeing this again and again whenever you are reading the muscle, but still this is causing flexion at elbow joint. So, this is the very important question. Though brachioradialis we are reading as a muscle of the extensor compartment, but it is not causing extension, it is causing flexion at elbow joint. It is not crossing the wrist joint. So, the action of brachioradialis is not seen on the wrist joint. So, you have this question in your exam, which of the following muscle of the back of forearm is not having any action on wrist joint? Answer is brachioradialis. Why brachioradialis? Because brachioradialis insert at the styloid process, and to act on the wrist joint it has to cross the joint. The second action is that it is the most powerful when the forearm is semi-pronated, and that's, now see, this is your supination. Now this is pronation, this is semi-pronation. Now when you will do this flexion of your forearm in semi-pronation, this action is very powerful of the brachioradialis. So brachioradialis causes flexion, but the flexion of the elbow is very powerful with this half or semi-pronated forearm. It is not a pronator or a supinator. So this should be very clear that brachioradialis is not helpful in the pronation supination. It is causing the flexion of your forearm at elbow joint, and it is not acting on the wrist joint. Now you have the two more muscle in the lateral or radial compartment, extensor carpi radialis longus and brevis. Now my suggestion is that whenever you are reading these two muscles, please read them as a single unit, because there are so many similarities between these two muscles. So that's why you are able to have this idea what is the difference and what is the similarity. So the name is extensor carpi radialis. Now this is longus and this is brevis. Clear? Now I already told you that this longus comes from the humerus, because we are reading the superficial group muscles. So this comes from the humerus and it is coming from the lateral supracondylar ridge, and the brevis is arising from the lateral epicondyle. But when you will see the arrangement, you know that the brachioradialis is the most superficial. Deep to brachioradialis you will have extensor carpi radialis longus, and deep to longus you will have brevis. So extensor carpi radialis longus is a long fusiform muscle under cover of brachioradialis, and extensor carpi radialis brevis is smaller than the longus and it is deep to the longus. Clear? So here you can see this, that this is your brachioradialis. Deep to brachioradialis you have the origin of this extensor carpi radialis longus. Now deep to extensor carpi radialis longus you have extensor carpi radialis brevis. Clear? Now what is the origin? So we have already discussed, it arises from humerus supracondylar ridge. It is also arising from the humerus but from the epicondyle. So what is the difference between the longus and brevis origin? Both are coming from the humerus, but one is from the supracondylar ridge, another is from lateral epicondyle. What is the insertion difference? Because these are going to insert into the carpal and metacarpal bones. That's why they are having the extensor carpi, and they lies on the radial side. That's why they are having radialis. Clear? If they comes on the ulnar side, then they should have the word ulnaris, but they are on the radial side, so they are having word radialis. So where is the insertion? They all are inserting in the metacarpal bones. Now this longus insert in the second metacarpal, and this brevis insert on the base of third metacarpal. So when you are writing the origin insertion of longus and brevis, the origin is different. It is from the supracondylar ridge, it is from epicondyle. The insertion is different. It is on the second metacarpal, it is on the base of third metacarpal. So here you can see the insertion. Now this is your first metacarpal, this is second, and this is third. So this is the insertion of your extensor carpi radialis longus. This is the insertion of extensor carpi radialis brevis. Clear? So this is the important difference to always keep in your mind. Now what is the innervation? Now innervation is by the radial nerve, but my dear student, you have to keep this thing in mind that extensor carpi radialis longus directly supplied by radial nerve. It is directly supplied by the radial nerve, while the extensor carpi radialis brevis is not directly supplied by radial nerve. It is supplied by a branch of the radial nerve, which is known as posterior interosseous nerve. So this is again the very important question in your exam. Here you can see that this is the radial nerve which is supplying this extensor carpi radialis longus. but it is giving a branch which is running in the posterior compartment, is known as posterior interosseous nerve, and this posterior interosseous nerve is supplying this extensor carpi radialis brevis, which is arising from the lateral epicondyle. So, you can say that both the muscles supplied by radial nerve, but more specifically the extensor carpi radialis longus supplied by directly from the trunk, but this brevis supplied by posterior interosseous nerve of your posterior compartment. Now, what are the actions? Now, when we will talk the action, there are two actions. One is extension at the wrist joint, second is abduction at the wrist joint. So, both extensor carpi radialis longus and extensor carpi radialis brevis are having similar action. What are these actions? Because they are present on the posterior side, they are causing extension at the wrist joint. But this extension of wrist joint is also come with the extensor carpi ulnaris. Extensor carpi ulnaris is a muscle which is present on the ulnar side. So, all these three are extensors. So, this muscle on the medial border and these two muscles on the lateral border, all the three will pull this wrist on the posterior side. While these muscles are present on the radial border, so the extensor carpi radialis longus, extensor carpi radialis brevis, along with the flexor carpi radialis, which is present in the flexor compartment, but on the radial side, all these three will contract to causes lateral deviation or abduction. So, here you can see that what is the action, that they are causing extension and abduction at the wrist joint. So, here you can see this video. Now, in this video, what you are able to see is that this is the extension, clear. Now, this is the flexion and this is the extension. Now, this extension is caused by the contraction of the extensor carpi radialis longus, extensor carpi radialis brevis, along with the extensor carpi ulnaris. Now, this is the second action, is the abduction. Now, abduction is also known as lateral deviation of the wrist. So, here you can see that this is your lateral side of your this forearm, this is the medial side. So, this forearm wrist, this your palm will shift towards the lateral side. Now, here you can see that this is the neutral and this is shifting towards the lateral side. Now, this lateral side shifting is possible because the muscles are acting on this part of the wrist joint, and this is not only the action on the posterior muscle, but on the anterior muscle, that is the flexor carpi ulnaris. So, muscles which are present on this part of your lateral side of your wrist joint, they are acting as a single unit. So, from the posterior side, these two long muscle, and from the anterior side, the flexor carpi ulnaris, all are contracting simultaneously and taking this wrist in the lateral aspect, which is known as abduction or lateral deviation of wrist joint. Now, there is one more word, is known as mobile vad of Henry. Now, mobile vad of Henry is a surgical term which is used for these three muscles which we just finished. So, what are these three muscles? These three muscles are brachioradialis, extensor carpi radialis longus, and extensor carpi radialis brevis. All these three muscles are also known as the mobile vad of Henry, which is a surgical term, and it is formed by the three muscles lies on the lateral aspect. Now, these muscles flex the elbow, this is the one thing, and the another important thing is that the group of muscle is relatively mobile as a unit and can be retract during surgery. So, because of their mobility, you can retract all these three muscles as a unit and you can create the space on the back of your forearm. That is why they are known as mobile vad of Henry. So, at the end of this class of the three muscles, you are now having idea what do you mean by the origin of the brachioradialis, what are the differences between the extensor carpi radialis longus and extensor carpi radialis brevis, and what is the meaning of abduction of the wrist joint. Clear? So, this is all for this class. Thank you.